Occupational Psychological First Aid, OPFA, Phase 2, Module Implementation of OPFA. Slide 2, Introduction. Course to train employers in Occupational Psychological First Aid, OPFA, for workers exposed to psychosocial hazards. Provides supportive and practical assistance tailored to culture, roles, and abilities. Slide 3, Learning Outcomes. Participants will learn to 1. Approach situations safely. 2. Provide supportive actions for distressed workers. 3. Avoid causing further harm. Slide 4. Learning Scope. 1. Introduction to OPFA. 2. Implementation of the 3L model. 3. Basic helping skills and self-care. Slide 5. OPFA, what it is versus what it is not. What it is: basic support for distressed workers, for professionals and non-professionals. What it is not: clinical counseling requiring professional mental health expertise. Slide 6. OPFA traits. Willingness to help. Accessible and connected to recognized agencies. Strong coping skills and support systems. Slide 7. Who OPFA is for. Workers in distress after crisis events. Do not force help, make yourself available. Refer to advanced support if needed. Slide 8. People needing advanced support. Individuals unable to care for themselves. Workers unable to perform due to distress. Those at risk of harming themselves or others. Slide 9 to 10. When and where OPFA is provided. When, during or immediately after a crisis, sometimes delayed. Where, safe, private places where confidentiality can be maintained. Slide 11. Why OPFA? Workers recover better when they feel safe, calm, and supported. Access emotional, social, and psychological support. Slide 12. Take note. Avoid spreading rumors or labeling others as it causes further harm. Slide 13 to 14. Managing stress. Stress container model. Stress levels vary among individuals. Stress can cause physical, emotional, and cognitive symptoms. Slide 15 to 16. Impact of crisis at workplace. Behavioral. Errors, withdrawal, substance abuse. Cognitive. Poor concentration, negative thinking. Emotional. Irritability, anxiety, low mood. Physical. Depression, PTSD, burnout. Slide 17. Ethical considerations. Maintain privacy and confidentiality. Obtain consent before assisting. Refer to experts when beyond your abilities. Slide 18 to 19. Definitions. Hazard. Potential sources of harm. Risk. Likelihood x severity. Slide 20 to 24. Occupational Safety and Health Act, OSHA 1994, Amendment 2022. Employers, duties. Ensure safety and health. Employees' rights. Report imminent dangers and remove themselves when necessary. Slide 25 to 26. Sources and classification of hazards. Types of hazards: ergonomic, psychosocial, biological, chemical, physical. Slide 27 to 30. Psychosocial hazards. Originates from task design, environment, and relationships. Identify hazards through surveys, workplace inspections, and worker interactions. Slide 31 to 32. Risk control. Use administrative controls like job rotation and setting clear policies against bullying. Slide 35 to 36. 3L intervention model. 1. Look. Assess for safety and serious distress. 2. Listen. Provide calm support without pressuring. 3. Link. Connect to resources and support. Slide 37. Do's and don'ts in PFA. Do. Observe, speak calmly, and acknowledge strengths. Don't. Share personal troubles, assume trauma, or provide false reassurances. Slide 46 to 58. Basic helping skills. Includes active listening, questioning skills, reflecting feelings, and summarizing. Observing verbal and nonverbal behavior. Providing relevant information without overload. Slide 63 to 68. Self-care strategies. 1. Physical. Regular sleep, diet, and exercise. 2. Mental. Reflective journaling and work boundaries. 3. Emotional. Mindfulness and positive affirmations. 4. Spiritual. Meditation and volunteering. 5. Social. Setting boundaries and time for relationships. Slide 74. Take-home messages. Maintain self-care and reasonable working hours. Support others but know your limits.